Now, you can see that this is actually the Runner's World Metal editor, which is actually George C. Henry. I met him many years ago. And in fact, he came out with this somewhere in the 1970s by saying that, you see, 60% of runners reported chronic problems from running. In other words, about 60% of runners at that time, 1970s and 80s, those days, they begin to actually have about 60% of having injuries and running problems. And now today, let's look at it in the year 2009. The figure has not gone down. In fact, has gone up even by 66% of so-called runners experience some problems. In other words, injuries and so forth. Let's next slide. Now, you can imagine, this is New York Marathon. Of course, Penang, in fact, is not that bad now. Just now when I saw, except I could not get those slides, you can see that there are so many runners running. Now, can you imagine if 60% of these runners having problems in this particular year? You can imagine how many of them are actually suffering. But do you want to be one of them? I'm sure you don't want. Let's see the next one. The next slide. Now, this is the figure. Again, 60% of them would actually have experienced some injury before. Next. Now, with 30 years of what's so-called this big running boom, which everywhere in the world now you begin to see a lot of people running. And this is even more, especially in the 80s, 90s, when running started to pick up. We actually were lucky during the time to join the crowd and begin to see all kinds of things during the time. This is really more than 30 years of experience, not only for us, but throughout the whole world. Let's see. Now they have better medical science knowledge. All of us know a lot now. In particular, even now today, we have one professor here, which is Professor Ravinder Singh, which we started somewhere in the 1980s. I mean, together in USM at the time, we started to actually doing something in what's so-called sports sciences. With all this knowledge, and of course, today, better apparel, better shoes, better equipment. Some even, just now, I think, what do you call this, one of our good friends actually brought the watch, trying to ask me how to tune it. I do not know how to tune the watch. I think that's a bit so-called high-tech for me, to monitor his heart and so forth. So you can imagine, with all these inventions, with all this health equipment and otherwise, trying to help us to be able to run better. Why? Just to make sure that you run nicely. To make sure that you come, you run, you're happy when you go back. Healthily going back. This is what we want. And we hope you get the kind of so-called feelings. Now we have experts in biomechanics, sports podiatrists, and then the physical therapists, dietitians, and so forth. Everyone, you can see that every type of what we so-called specialists now involved. Therefore, sports medicine team or sports sciences team is not only one particular one. Even here, our professor in physiology is also involved in what's so-called sports sciences too. Now, the question is that you can see the unfortunate part is that most of us do not agree in everything that we say. Why is it so? Why is it so difficult? Simply put, the reason is because all of us do not come from the same parents. Even when you come from the same parents, you don't share the same genetic codes. Look at your brother and your sisters. They may look similar, but not the same. If I take the chromosome, if I take the other ones, what's called the DNA, and analyze it strictly, they're not the same. In other words, every one of us is our own individual. We have our characters, we have our behaviors, and we have definitely endowed differently from the others. And because of this, therefore, our body actually is so-called we inherited that kind of genetics set up in us that set us for what we want to do. In other words, no two person can actually come up with the same type of feet that we have. Every foot is different. And therefore, whatever shoes that can fit me doesn't mean they will fit you. So don't buy because your friend buys the shoe. Let's come to that afterwards. Okay? Now, so it is because of this, therefore, we continue to do a lot of research. Today we are so happy because I was so happy that I met Prof. here. I said, okay, let's do some research. In fact, research goes on all the time. While we are talking, while we are sleeping, while we are working, research goes on all the time. What are they trying to do? Trying to improve, giving us better understanding of so-called sciences.